Campaign 2020 is sponsored by Wisconsin Hospital Association, Quick Trip, Wisconsin Counties Association, Wisconsin Realtors Association, and Wisconsin Operating Engineers Local 139.
State Representative Amanda Stuck of Appleton is the Democratic candidate in the 8th Congressional District. Amanda, welcome back to WisconsinEye.
Thank you for having me.
Well, for years you've been focusing on state issues. Now you've broadened your interest to a whole northeast section of Wisconsin. So I guess my first question, as you make the jump to congressional candidate, what do you consider your top issue?
Well, to me, it really is about how we represent people and about the state of politics right now, and really making sure that the people here have somebody who is really putting them first. So even though I've been focused on the state level, I actually started at the federal level, working for the last Democrat that held this congressional seat. And what I really take away from those days was just his commitment to the people in his district, to really representing them, to being available to them on the ground. And I think that's something we just don't see now in our current leadership in this position. So to me, it's really about bringing this seat back to the people, having a representative who will really be on the ground, somebody who puts the people over politics and will always do the right things, even if it isn't popular with the party.
Well, I've always been struck by the diversity in the 8th Congressional District, from manufacturing to the Packers, Door County tourism. How has the 8th District done with the pandemic?
Yeah, so it certainly has hit us here. In fact, some of the counties in this district were hotspots that were highlighted nationally because we had such outbreaks. And as you mentioned, this is such a diverse place, and so it hasn't really left an area of our economy or our constituents untouched, whether it is tourism in Door County, which certainly was hurt by the lack of people willing to travel, whether it was our food industry, which we saw huge breakouts at our meat plants here in the 8th Congressional District. It certainly has touched every area of this district. What we hear most often about it is about unemployment. So folks who have lost jobs because of this, or have now become underemployed, even if they're still working a little bit. And whether it is trying to get those unemployment benefits or trying to find work, or businesses trying to stay afloat because of it, that is the number one thing we do hear about now when we're out talking to folks or when folks are reaching out to us.
Well, the gridlock in Washington on the next COVID-19 package. What should be in the next COVID-19 package from Washington to help the 8th Congressional District, please?
So there's a couple things that I've heard about specifically from people here in the 8th that they've reached out to their current congressman on that hasn't been really willing to work with them. So that is more unemployment, expanded dollars to make sure people are still able to get those unemployment checks at an expanded amount that can really make sure that they can afford to pay their bills, keep their homes, put food on the table. One other really big thing here in particular in the 8th Congressional District would be something in there that would help people who are at risk of losing their pensions right now. So we know this has been an issue in Congress, where there are a lot of union pensions that are at risk of going under because of the 2008 recession. And there were some bills before Congress that we just couldn't get passed that would save these pensions. And so they're trying to also get this included in some of the next packages around COVID, because of course we know that if people lose their pensions right now, when the economy is already having a rough time, that this will be terrible. So that's something very specifically people right here in the 8th have been trying to push for in the next package.
Well, do you think we should have another round of additional 600 weekly unemployment benefits from the feds, which would be in addition to the state benefit, maximum benefit of 370? Should it be 600? And if so, should it go through the end of the year, 2 months, 3 months? Your thoughts on any additional federal UI stipend?
I certainly think it should be the 600 because, again, most people just can't live off $300 a week or $300+ a week. That just isn't realistic. So for families that really have no options, it's not that they just don't want to work. It's not that they're choosing not to work. There simply just aren't the jobs because of what's happened. They need to have real wages coming in, real money from unemployment that can make sure they can pay their bills and meet their needs. Again, that $300 a check right now that they're getting just won't cut it. So we really do need that expanded amount. In terms of time frame, I think certainly through the end of the year would make sense, but I think we also need a Congress that's willing to work together and really pay attention so that if it needs to go longer, we can react quickly instead of having these political debates that drag it out and leave people hurting. So I think certainly through the end of the year will be realistic, but who knows really how long this will impact us. This isn't something that's going to just bounce back overnight.
The COVID-19 packages from Washington threaten to take our national debt from about 23 trillion with a T to about 27 trillion. Is the national debt issue, is this an issue that we have to set aside to offer some immediate relief to these people and industries and businesses that have been hurt by COVID?
I think to some degree right now helping people needs to be the main focus to get through this pandemic. But I also think that our response doesn't necessarily have to get us so much more into debt. We have priorities we can make. There's no reason why sports teams and billionaires and wealthy businesses should be getting the stimulus money or should be getting these checks. It should really be targeted to those that need it. And then it certainly cuts down on the amount that we are adding to any debt that we have.
Are you willing to vote to spend less on the Pentagon and the Department of Defense budget?
I think that's certainly an area where we need to look at it and say, are there things right now that aren't necessarily needs, that are more wants? And then figure out if there are areas that we can make cuts to make sure that people can have food on their table and gas in their cars and a roof over their heads. I think certainly there is no part of the budget that should be left untouched. We should be looking at all of it to figure out, again, what are our priorities? And if it's not the priority of taking care of people, then maybe for now it needs to go.
President Trump has said he'd like to get rid of federal payroll taxes through the end of the year. What's your position on that?
So I would be against that because essentially that's going to be an attack on Social Security. And it's really a way to get around at his ultimate goal that he's had all along at reducing Social Security benefits. And unfortunately, that is such an important safety net, especially here in Northeast Wisconsin, where we do have a population that tends to trend a little older that depends on those Social Security benefits, that any attempt to move to do anything that makes that fund move towards insolvency or to make benefits less for the people that get those is something we just can't do. There are a lot of other ways to go about addressing what's happening right now.
Mitch McConnell has said any COVID-19 deal should make immune businesses and organizations that have followed CDC protocols to protect their customers and employees from lawsuits. Is that a reasonable thing to put in the next package?
So to me, I certainly think it's something that we should look at. I know I've had businesses here in the 8th Congressional District call me already asking basically for the same thing. I do think obviously we want to make sure that no businesses are just outright ignoring what the CDC is recommending, but certainly if businesses are doing everything they can, we do want to protect them to make sure that our businesses don't go under here if they really are doing the right thing. So I think it's reasonable. Again, it always comes down to the language and exactly how it's written to make sure we aren't protecting bad actors, but I think it's certainly a reasonable thing to look at and try and include in whatever we do moving forward.
One final question on the pandemic. Do you favor a national moratorium on evictions and foreclosures through the end of the year?
Yes, absolutely. Because again, so many people, if they're not able to pay those bills right now, again, it's not because they're choosing not to work. It's not because they're just irresponsible. It's simply because this pandemic is out of their hands. It's out of their control. So I think that's something we should definitely look at.
The U.S. Supreme Court just announced it'll hear arguments on whether Obamacare is legal after the November 3 election. If the court should throw it out, and you're a member of Congress, what will you push for on health care?
Yeah, so I was actually working for the congressman in the 8th Congressional District when we passed the Affordable Care Act. So I certainly remember what it was like trying to get this passed and the calls we got and the town halls we went through during that time. So I know how important this bill really was to people. I remember getting those calls before we passed it where people would say, I'm going to die if you don't do something. If you don't pass this, I'm going to die because I have no options for healthcare. So it's really, really important that we make sure that there's always something for people. If for some reason the Affordable Care Act went away, we would certainly need to make sure there was some sort of plan that everybody has access to, whether or not, whatever their income is, whatever they're doing for a living in terms of a job, we need to make sure that everybody can get access to health care. Now, certainly, I think the Affordable Care Act won't go away. There's a reason why Republicans haven't been able to get rid of it so far, because most people like knowing that if they have a pre-existing condition, that doesn't mean they can't get insurance, or they like knowing their children will be covered while they're going to college. They like most of the stuff that's in the Affordable Care Act. And for the most part, there is agreement on that. So I think we can start with those basic parts of the Affordable Care Act that people do like and continue to build all off of that and improve where we still have issues with premiums or access for people, because it isn't perfect. We still have things we need to fix, but we can start with the basic fundamentals of the Affordable Care Act that people do like, find agreement there, and then keep building until we really reach that goal where everybody has affordable and accessible health care.
So when presidential candidate Biden talks of a public option, Bernie Sanders wants universal care. Your goal is eventually universal care, right?
I think there's all kinds of good plans. I don't think that there's necessarily one that we have to say is the goal, right? I think Tammy Baldwin has said this pretty well. That Democrats have all kinds of ideas on how to address healthcare, and they all have pros and cons. There's none that's perfect, but they're all better than nothing and people dying because they can't get access to healthcare. So I think a public option would work. Universal healthcare work. Whatever title you want to use, there are all kinds of good plans. Again, none of them are perfect, so we'll have to actually get people to sit down at the table and hammer out those details, because there are pros and cons with each, and none of these things are in a bubble. So if we are going to, for instance, change healthcare, at some point we're going to have to talk about student loans, because you can't have doctors coming into systems with huge student loans if, for instance, they're getting paid Medicare reimbursement or Medicaid reimbursement dollars. So, these things aren't in a bubble. We have to look at all of this when we're talking about healthcare. So whatever the plan is, it will be complicated. It will require sides to come together and have real discussions about how we move this forward. So again, that's why I won't say one specific plan, because it's all about bringing to the table, hammering out the details, and getting to the ultimate goal where everybody has healthcare. Let's talk about immigration reform. What's your message to young adults, the DACA young adults who were brought to the United States as children? What's the solution there? Yeah, I would say that we want them here, that having them here makes our country better and richer. And so that certainly we need to work on finding a way forward to allow them to become citizens, especially if they lived their whole lives here, worked here. There's no reason that they should be paying more to attend our university system here, or they should face additional barriers in trying to achieve the American dream. So we certainly want them here. We need to fix our immigration system from the top to the bottom. Right now, there's just no way to really come here legally. It's nearly impossible between the cost and the time it takes to get through the system, which can be years. So we really do need to look at that system. When I call through employers in Door County, that's the number one thing I hear about, is just how we have these limits on certain visa programs that they need to bring workers in that are totally arbitrary. They have nothing to do with the need. They have nothing to do with what keeps businesses going up there. They're totally arbitrary caps. So we have some systems that already work. We just need to lift those numbers and get people here because our businesses need them, because again, we're all better. We're all immigrants. Truthfully, my grandfather went to a school that taught in German in Brillion, Wisconsin. And there was a time when German was the most common language spoken and taught in schools around here. So we are all immigrants, and it really is what makes us good and makes us stronger. So there should be a path to citizenship for those that are not here legally? Absolutely. The whole debate over policing reforms. What national policing reforms do you support? So, certainly I think that there are some packages even at the state level that could be brought forward to a federal level that we've been discussing, that the governor here has called for us to take up in the special session that was supposed to happen this week. So a lot of it is just around data and collecting data on use of force, because of course you can't really make good decisions if you don't have good data. Also requiring extra training and standardizing training that police force get right now, because right now it really just depends on where you are, what city, what state you're in. The training that is required could be totally different. And so I think we need a lot more training. Even right here in Northeast Wisconsin, I was looking up training for police officers and nurses, and you actually need more training to become a nurse than a police officer. And it's just very interesting when you look at those requirements. So more training, especially around de-escalation, around mental health issues, crisis intervention training, de-escalation. Those are all things that we really need to make sure are required in every single police department.
Well, how do you respond when President Trump and Congressman Gallagher say the protesters, and they sometimes use the term terrorists, are trying to rewrite the nation's history? What's your response to that?
I would say they aren't rewriting it. I think they're telling their story of what their experience has truly been. I'll tell you, even personally, I lost a friend to a police shooting when he was suicidal. So I know personally that this does happen. And of course, it doesn't mean always that police officers are bad or wrong, but it doesn't mean that we can't also look at how we can do better and look at these cases to see where, again, either training or data or other things could help us make it happen so it never has to happen again. And again, I think it's important that people are open to hearing the perspective of people who maybe haven't had good relationships or good perspective with police officers. And what I know is that most good police officers do understand that, and they want to do better, and they want to improve what they're doing. So I would say it's not that people are against each other. It's not that people want to cause problems. I can tell you specifically from protests I've attended that in the organizing in the events, it's made very clear that they don't want people engaging in criminal activity. They don't want people engaging with people on the other side in a negative way. And so I don't think that's really the goal of anybody. It really is just about trying to highlight the fact that there have been some problems, that there is mistrust in communities of color. I have friends in the Hmong community that will even joke about driving. They call it driving while Hmong, knowing that they are more likely to get pulled over. They get pulled over several times a month, where I maybe get pulled over once every other year. It's just a different experience for them. So we have to be honest and create space to share these experiences to really talk about how we can do better.
Then final question, highlight differences, if you will, between you and the incumbent that you're trying to oust on November 3, please.
Sure. So one of the biggest things I think is just life experience. So I was born and raised here in Wisconsin. Mike Gallagher was born here, but then went to California, where he went to one of the most exclusive, high schools in California. And, he comes from wealth and privilege. I was a single mom who put myself through school. So I think one of the biggest things is that I just really know what people are going through here every single day. I know what it's like to work multiple jobs and still struggle to get ahead. I know what it's like to just have to work for every single thing you have and not come from that privilege that just kind of hands it to you. And so that's why I would really be the person that would put the people above politics. And I've shown it, whether it's creating the Future Caucus here, which is a bipartisan caucus, or speaking out against my own party when I have to really say that we have to put people above party politics or leadership, where Mike Gallagher has always just touted the party line, has never been willing to push back, even when it really meant something to the people here in his district.
Thank you. State Representative Amanda Stuck of Appleton is a Democratic candidate in the 8th Congressional District. The election is November 3. Amanda, thank you for talking to WisconsinEye.
Yeah, thank you.
Thank you.
Campaign 2020 is sponsored by Wisconsin Hospital Association, Quick Trip, Wisconsin Counties Association, Wisconsin Realtors Association, and Wisconsin Operating Engineers Local 139.